Hi friends, welcome back to my channel, and today we are going to discuss another case note. So let's read together. You are Ramona Di Costa, a senior nurse working with Helpline Hospital. Patient name Tom Clarke, date of birth is given, address is given, and telephone number. Social background married, wife Miranda Clarke, aged 58 years. Lives together, retired police officer, two daughters. Elder daughter works in Sydney, younger daughter Adelaide, quite active. Then medical history given hypertension. From these points, what all information we have to include? The name, of course, a date of birth, then the social background. If it is important, then only you should include. How we can select the relevant information? If you feel the reader needs to know this information in order to provide the care, at that time you can use the information. Otherwise, if you cannot attend this word count, the 180 word count, that time also you can use the semi-relevant information. Otherwise, you should avoid the irrelevant information. Until here, it's clear for you, isn't it? So let's move on to the other part. Medical history. Hypertension 1985. Did not seek treatment till 2000. Now managed with Ramipril. GERD 1999. That is gastroesophageal reflux disease. You should familiarize with the acronyms. Then the surgical history is given. Right angle dislocation surgery following a car accident in 1982. Hospitalized for 3 weeks. Septoplasty 1985. Surgery for anal fistula 1992. Eye replacement lens surgery 2007. Then hobbies mentioned. From this all surgical history also we should segregate what all information, what all history the reader wants to know in order to provide the care. Then only you should include that one. Okay. The other part, 26/8/2016, accident with a motorbike while cycling, claimed he was going at a moderate speed. A motorbike hit him while overtaking. He landed on the left side of his body, push, that is fall on outstretched hand, injury to elbow, left elbow, presented to ER, limited range of motion and extreme pain, X-ray, non-displaced fracture of the coronoid process of the ulna, edema, head and neck of radius involving articular surface, moderate joint effusion. So these are the problems when he presented, he had. And let's move on to the treatment. Sling to keep the elbow immobilized for 6 weeks, capsule, CM plus Panadol, ibuprofen, hot compress for pain and inflammation. Next appointment in 6 weeks time. On 6/10/2016, X-ray, injury healing well, tab Degain QW and tab CM plus QD, sling taken off, exercise program at home. Then 1/11/2016, patient complains of stiffness and limited range of motion in the elbow, arrange home visits by physiotherapist for rehab program. Then the tablet again, the Degain QD and tab CM plus QD for pain like analgesia. What are the information we have to take from here? The treatment and the medications, then appointment, then subsequent visit, what happened, the injury already healed but he complains stiffness and limited range of motion in the elbow. That's why they recommended for a rehab program by the physiotherapist so it can improve his condition. Then next, follow-up appointment is on 15/12/2016. So the writing task is write a referral letter to Amit Kumar, physiotherapist. Then the address is given, Suite 5379 Swanston Street, Melbourne, requesting home visits from the physiotherapist. So how we can analyze a case note? First, see your position. You are a registered nurse in so and so hospital. Then the patient name is given. Then go directly to the writing task. We should know who is our reader. Then accordingly we have to select the information. So we have to, now here it is physiotherapist. So what all information we have to include means it's mostly related to the mobility issues like that. So how we can frame a letter? So the reader is Mr. Amit Kumar, physiotherapist, Suite 5, 379, Swanston Street, Melbourne. The date is 1st November 2016. Then the salutation, dear Mr. Kumar. Reference Mr. Tom Clarke, date of birth 21 September 1954. And how we can write the introduction? I am writing to request home visits for Mr. Tom Clarke, who has stiffness and limited range of motion in the elbow. He requires rehabilitative care and management. Next, we have to mention Mr. Clarke present to the emergency department on 26 August 2016 due to limited range of motion and extreme pain on his left elbow following a motor vehicle accident. A non-displaced fracture of the coronoid process of the ulna and moderate joint effusion were revealed in the X-ray. Consequently, his elbow was immobilized with a sling until his next appointment. His pain was managed conservatively. Why we are not mentioning the pain medication name? Because he is a physiotherapist. He is not dealing with the medication. That's why. Next we can mention on his follow-up visit or on subsequent visit on 6th October 2016, an X-ray was performed which showed healing of injury. Subsequently, his sling was taken off and has been advised for an exercise program at home. He has been prescribed pain medication. Today, Mr. Clarke represented with the persistent symptoms along with the stiffness on his affected elbow. Why did I use persistent symptoms? Because we mentioned already the stiffness and limited range of motion at the beginning. If we repeat it, it will be redundant. So what we have to do? Like persistent symptoms or same complaints like that we can use. In order to meet the word count, what we can do? We can write the social background. Mr. Clarke is a retired police officer who lives with his wife. No need to mention the daughters are away like that. Then the hypertension, it doesn't have much importance in them. Then we can mention he had a history of right angle dislocation surgery following a car accident in 1982. It was already completed. Actually, it was semi-relevant, but and here we can mention because the word count is less. Actually, there is not that much discharge plan, so we can write considering the above information, it would be appreciated if you could provide supportive care for Mr. Clarke to return to his normal life, like that we can write. Then please note he has an appointment on 15th December 2016. The conclusion sentence as usual. Please do not hesitate to contact me if you have any queries regarding Mr. Clarke. Yours sincerely. As the name is given, we can write, otherwise even the senior nurse is enough. Miss Ramona Da Costa. How do you feel? Are you confident enough to write the OET letter? And is it easy to segregate the information and select the relevant information? By practice, anyone can do this. Okay, so try to do in your own way. Don't copy others, so it can increase your score during exam. Thank you for watching and supporting me. Thank you very much.